Hi guys, welcome to my presentation. Myself Ajinsha. Today the topic of my presentation is function of hip joint. First we can see about motion of femur on acetabulum. Convexity of the femoral head within the concavity of the acetabulum moves in 3 degrees of freedom. The 3 degrees of freedom are flexion or extension movement, abduction or adduction movement, and medial or lateral rotation. The femoral head will glide within the acetabulum in the direction opposite to the movement. During flexion of hip, the head spins posteriorly, and during extension, the head spins anteriorly. During abduction, the hip glides inferiorly, and during adduction, the hip glides superiorly. During lateral rotation, the hip glides anteriorly, and in medial rotation, the hip glides posteriorly. Range of motion. The flexion of hip joint is generally 90 degree when the knee is extended and 120 degree when the knee is flexed because of two joint hamstring muscle tension is released. Range of motion of hip extension is 10 to 20 degree. Abduction of hip is 45 to 50 degree and adduction of hip is 20 to 30 degree. Medial and lateral rotation of hip typically range from 42 to 50 degree. Motion of pelvis on femur. When the hip joint is weight bearing, the femur is relatively fixed and the motion of the hip joint is produced by movement of pelvis on femur. It can be called as many titles. They are anterior and posterior pelvic tilt, lateral pelvic tilt, and anterior and posterior pelvic rotation. First we can see about anterior and posterior pelvic tilt. Anterior and posterior pelvic tilt are the motions of entire pelvic ring in sagittal plane around a coronal axis. In normally aligned pelvis, the anterior superior iliac spines lie in a horizontal line with the posterior superior iliac spines. In anterior pelvic tilting, the ASIS moves anteriorly and inferiorly, whereas PSIS, that is posterior superior iliac spine, moves upwards and pubis comes closer to the femur. In anterior tilting, there is an increase in lumbar curvature and here the hip flexion movement occurs. In posterior pelvic tilting, the posterior superior iliac spine moves backwards and downwards, whereas pubic symphysis comes up and the sacrum of the pelvis comes closer to the femur. In posterior tilting, there is a decrease in lumbar curvature. Here the hip extension movement occurs. In this picture, you can view what happens in anterior and posterior pelvic tilt. Next, we can see about lateral pelvic tilt. Lateral pelvic tilt is a frontal plane motion of the entire pelvis around an anterior-posterior direction. In normally aligned pelvis, a line through the ASIS is horizontal. In lateral tilt of the pelvis in unilateral stance, one hip joint is the pivot point or axis for motion of the opposite side of the pelvis as it elevates or drops. If a person stands on the left leg and hits the pelvis and the left hip joint is being abducted because the medial angle between the femur and a line through the anterior superior iliac spine increases. If a person stands on left leg and drops the pelvis, the left hip joint will adduct because the medial angle formed by the femur and a line through the anterior superior iliac spine decreases. Here in this picture A shows that kicking of the pelvis around the left hip joint results in left hip joint abduction. B shows that dropping of the pelvis around the left hip joint results in left hip joint adduction. Next we can see about lateral shift of the pelvis. Lateral pelvic tilt can also occur in bilateral stance. Here, the hip and knee of one limb are flexed. If both limbs are weight bearing, the lateral tilt of the pelvis will cause the pelvis to shift to one side or the other. Here in pelvic tilt, the pelvis cannot hick but can only drop. If the pelvis is shifted to the right in bilateral stance, the left side of the pelvis will drop, the right hip joint will be adducted and the left hip joint will be abducted. Next we can see about anterior and posterior pelvic rotation. Pelvic rotation is a transverse plane motion around vertical axis. In bilateral stance, the axis is through midline of the pelvis and in unilateral stance, the axis is through the supporting hip joint. In forward rotation, the unsupported pelvis moves anteriorly and produces medial rotation of the supporting hip joint. In backward rotation, the unsupported pelvis moves posteriorly and produces lateral rotation of the supporting hip joint. Next, we can see about coordinated motions of the femur, pelvis and the lumbar spine. When the pelvis moves on a relatively fixed femur, there are two possible outcomes to consider. Either the head and trunk will follow the motion of the pelvis, or the head will continue to remain relatively upright and the vertical despite the pelvic motions. These are open and closed chain responses respectively. Then we can see about pelvifemoral motion. What is pelvifemoral motion? When the femur, pelvis and the spine move in a coordinated manner to produce large range of motion than in available to one segment alone, the hip joint is participating in what will predominantly be an open chain motion is termed as pelvifemoral motion. Pelvifemoral motion has also been referred to as pelvifemoral rhythm. Here in this table, you can view the relationship of pelvis, hip joint and lumbar spine during right lower extremity, weight bearing and upright posture. Thank you all for listening to my presentation.